Hello, welcome to the Veterans Memorial Medical. And I know you're here for a report on your English subject.
Health ethics.
Come again?
Health ethics.
Health ethics. Oh, incidentally, I am Dr. Girly Aurelio, the department head of the dentistry.
Can you...
So ikaw ang nakikita?
Opo, first po,
sis,
yung
okay.
magtatanong po muna, para po may evidence.
Tama.
Can you tell some stories you encountered about unethical practices that a dentist you know did?
I'm Mariel Espinosa. I'm happy that you have considered me and Dr. Aurelio to be your respondent in your topic under the tutorship of Dr. Torresca. First, let us define what is unethical behavior. Ethics is the accepted norms of conduct of a professional, or it could be a human being. The norms of conduct is the sense of values of what we hold dear in our hearts, in our thoughts, and in our way of dealing with others. Ethics is also the commission of an act which should not have been done, or it is also defined as an omission of an act which should have been done. Do you follow,
Yes.
Mariel?
Yes.
Okay. Now your question is some sort of me documenting an ethical behavior which I have seen or observed
Yeah.
in my practice as in the profession of dentistry. You know, Mariel, I'm sorry to say my sentiments regarding that question, because that in itself, answering that question would constitute an unethical behavior on my part. It's just like washing dirty linens in public. I would rather suggest that you reformat your questioning in the way that it would be easy for me or for your other respondents to answer your question. Say, if I may suggest what constitute an unethical behavior. Okay. Unethical behavior could be directed first to our patients. You being a future dentist, no? Say for example, you're dealing with a patient, and that patient, you and your patient have agreed that you do porcelain fixed bridges for him. Unfortunately, you took the side step and you did plastic crowns on that patient. That is unethical. Unethical behavior would also charging patients exorbitantly, because dentistry is such a service-oriented profession. Remember, the goal in dentistry is to provide for ourselves comfortable living, not luxurious living. So if we charge our patient exorbitantly, that is unethical behavior. Another would be engaging in malpractice, perhaps tolerating a non-licensed dentist to work on your private office. That is unethical and illegal as well. Another thing would be suggesting to a patient treatment which is not indicated to his best interest. Like for example, suggesting to that patient to have some fixed bridges so as to generate more income. That is unethical behavior. Let me expound on engaging in malpractice. That is unethical behavior. My example earlier was that of tolerating a non-licensed dentist to work on your private office in your absence. Another Just example would be, supposing, like your dad, Dr. Gabriel Espinosa, is a maxillofacial surgeon, a very good maxillofacial surgeon. If a dental clinician would perform oral surgery beyond his field of expertise, that is unethical behavior and illegal as well and risky as well. Because we should be protecting our patients from further harm. Remember, there's also a dictum in dentistry that if you cannot do any good to anybody, do not do any harm. So that would be a very classical example of unethical behavior, the malpractice beyond the realm of your expertise. Unethical behavior directed to a colleague. Say for example, unnecessarily, you are bad-mouthing a colleague. You are bad-mouthing the profession. That is unethical behavior. Unethical behavior also includes our duty to continuously update our knowledge. If we fail to do so, that would also constitute unethical behavior because our patients deserves nothing but the best. We should be able to address the demands of dentistry in the way that we should be globally competitive with the rest. Remember our theme for this PDA convention, a stronger and globally competitive dentistry. Since your topic encompasses a lot of things, perhaps I could give you some more example. Here at the Veterans Medical Center, being hospital dentists, we should be routinely attending 24 hours duty on emergency call. Failure to do so would constitute an ethical behavior because anybody, even though you are not a professional clinician, if you fail to attend an emergency situation, that is unethical. And more so, in some countries, that would be illegal. Remember the case of Princess Diana, wherein some bystanders did not attend to the call of emergency referral of the princess. So much so for that. Another form of unethical behavior would be indecency, as I've said earlier. This is the unaccepted this is a deviation from the accepted norms of conduct. Indecency, gambling, drinking, engaging in illegal practices. That's unethical behavior for dentistry. You see, they have laid down high standards on the practice of dentistry. There are standards which are governed by common sense and logic, and most of these cannot be enumerated all at the same time. There are more forms of unethical behavior, and we could quote some more, but in a more period of time. I hope in my little way I have given you an idea of what I surmise what unethical behavior. I hope in the near future we get to be together in your hospital internship because there are plans or proposal to revive the hospital dentistry program here. The students of UE being interns here. We used to hold the internship program in the Central Escolar University. But perhaps we could season this program soon.